6 amazing teas to suck the sugar out of your blood. In other words, we're going to talk about teas that are excellent for treating both diabetes and pre-diabetes. And diabetes is a very common problem, not just here in Brazil, but worldwide as well. So here in Brazil, we have around 40 to 50 million pre-diabetics and 17 million diabetics, meaning almost 10% of our population has diabetes. And globally, there are hundreds of millions of diabetics too, almost billions of diabetics, I believe. So among pre-diabetics, 1 in 4 becomes diabetic, making it a very common disease, a disease we are accustomed to living with, but it is a disease that carries risks. Diabetes can cause blindness, it can cause circulation problems, it can lead to chronic kidney disease, causing your kidneys to stop functioning. So diabetes is something that needs to be treated. Folks, there are 2 main types of diabetes, type 1 and type 2. In type 2 diabetes, which is the most common type accounting for about 90% of cases, what happens? 2 diabetes, which is the most common type accounting for about 90% of cases, what happens? A condition called insulin resistance occurs. The body's cells don't respond properly to the insulin produced by the pancreas, leading to an accumulation of glucose or sugar in the blood. Why does this happen? One of insulin's roles is to reach your cells and say, hey cell, look, we have an increase in blood sugar levels, so I'm asking you to take some of this sugar out of the blood and absorb it for yourself, okay? That's what insulin does. However, the cell may be resistant to insulin, and it will say, no insulin, I won't do that. And then the sugar continues, remaining in high quantities in the bloodstream, which can cause numerous health problems. Alternatively, the cell may be sensitive to insulin and say, perfect insulin, asking me to do. I'm going to remove the sugar, the glucose from the blood, and take it for myself. So type 2 diabetes is caused by pancreatic overload, which is a pancreas that produces more and more insulin, but this is insufficient to stimulate the cells in your body, generating high levels of sugar in the blood. Generally, type 2 diabetes is diagnosed in adults, but it can be present at any age and is directly related to being overweight, obesity, sedentary lifestyle, diet, physical activity. So lifestyle is fundamental, both in the prevention of type 2 diabetes and in the treatment and reversal of this disease. And the most significant environmental risk factor is obesity. And in the past, we saw that type 2 diabetes was a disease of older people, of the elderly. But today we see that as the population is eating worse and worse and becoming heavier and heavier with more overweight, we are observing people with type 2 diabetes from an early age. And genetics does influence, but the main factor in type 2 diabetes is habit and lifestyle. Now let's talk about teas. Given this introduction on the topic of diabetes, grab a pen and paper. I have selected 6 important teas that are affordable and that you can find in any store or market. So tell me, from which part of Brazil or the world are you watching from now? I'm in the capital city of Rio de Janeiro, and I don't have diabetes. What about you? Do you have diabetes? And where are you joining from? Write it in the chat or in the comments while I talk about our first tea, which is green tea. Why does green tea help combat diabetes? First, because it does what I mentioned. It improves insulin sensitivity due to a substance called epigallocatechin 3 gallate, which we also refer to as EGCG. In addition to EGCG, green tea also contains polyphenols, which help regulate glucose metabolism. Who needs to be cautious with green tea? People who are very sensitive to caffeine, because it does contain caffeine. So it's also not suitable to drink close to bedtime, as it can make a person feel excited. And by excited, I mean accelerated or hyper, not any other type of excitement. It can also interfere with anticoagulant medications, especially coumarins, such as warfarin, sold under the brand name Maro. Our first tea is green tea. The second tea is cinnamon tea, because it has a Cinnamon contains a substance called coumarin, which helps reduce blood sugar. Polyphenols, also present in cinnamon, contribute to improving insulin sensitivity. However, be cautious. Anticoagulants such as Maravan or warfarin, be careful with. Additionally, people with severe liver disease need to be cautious. Also, if you're already taking medication for blood glucose, you have to be a little careful as well, because your blood glucose to drop too low, leading to hypertension. This is something we want to avoid. Pregnant women. Understood? The third tea is ginger tea. Ginger tea contains gingerol, which helps reduce phytochemicals present in it, also regulating glucose metabolism. Who needs to be cautious with ginger? People who have gallstones, people who have a problem with their gallbladder, because ginger can stimulate the production of bile and in a way overload a gallbladder that isn't functioning as well, an exacerbation of the signs and symptoms of these gallbladder problems. It can also interact with anticoagulant medications, coumarins, and also with aspirin. And be careful, once again, the same thing applies to cinnamon. If you take metformin and drink ginger tea, it's possible that your blood sugar may drop quite a bit. So if you frequently use these teas, it's very likely that after some time, if in addition to drinking the teas, you also to your lifestyle, this may cause you to need to reduce the dose of the medications used to treat diabetes. The same thing goes for blood pressure. Ginger is a substance, a product, a food that helps to reduce blood pressure. So if you take ginger, it's possible that your blood pressure may drop more than desired. The fourth tea is hibiscus tea, which is rich in anthocyanins. These are substances responsible for giving hibiscus its reddish color, which is also present in various red fruits and berries. These anthocyanins, in addition to being very due to their vasodilatory properties, also help reduce glucose and blood sugar levels. Furthermore, hibiscus contains a substance called hibiscus acid, which helps improve insulin sensitivity. Who needs to be cautious with hibiscus tea? Pregnant women, breastfeeding women, and people taking antihypertensive medications should be cautious because hibiscus can reduce blood pressure and has a certain diuretic effect. So, if you drink it too close to bedtime, you may urinate frequently throughout the night, which can disrupt your sleep. These are the precautions we need to keep in mind with hibiscus. Our fifth tea, which we have already discussed in a video exclusively about it, is bay leaf tea. It contains cineol, which helps reduce and regulate blood sugar levels, and also has flavonoids that contribute essential for the treatment of prediabetes and diabetes. So everyone, diabetes and prediabetes are conditions that involve insulin resistance, so are insulin sensitivity. Is this understood? I think it is. I'm being clear, even repetitive, to make it very comprehensible for you. Who should avoid or be cautious with bay leaf tea? Pregnant women, breastfeeding women, people who take anticoagulant medications like Maravan or warfarin, and also people who use anti-diabetic drugs due to the risk of hypoglycemia, due to two factors that reduce the amount of sugar in the blood. And the last tea I'm going to discuss, but before that, I kindly ask you to like this video, all right? I see that we have nearly 200 people online, but only 99 likes. So why am I requesting this like from you? Because your like can help someone you don't even know discover who doesn't require metformin yet, who doesn't need to take insulin yet. She discovers these teas, she watches this video here, and then she follows our recommendations into practice, and she has her pre-diabetes or diabetes reversed. So everyone, your thumbs naturally and with fewer side effects, okay? Tea, which contains rosmarinic acid, also present in rosemary. Rosemary polyphenols in lemon balm also improve insulin sensitivity. Be careful because lemon balm tea can cause drowsiness. So if you're going to operate machinery or drive, you need to be cautious with lemon balm tea. And the same goes if you take any sedative medication, such as or any other benzodiazepine medication in particular. All right? So folks, these are the 6 teas that can help lower your blood sugar levels. To recap, they are ginger tea, cinnamon tea, and also green tea, okay? These teas will glucose levels, improve insulin sensitivity, and help you better manage your blood sugar levels. However, these teas alone will not be able to solve your problem. For example, it's not advisable to start drinking cinnamon tea every day, taking metformin. No, I'm not telling you to stop taking your prescribed medication. Don't do that. Only make changes to your treatment, the approval, knowledge, scientific understanding, and recommendation of your doctor who is treating you. Even though I am a doctor, this is not a medical consultation. I'm simply providing you with information, all right? So you should not stop taking your medication. If you have diabetes or prediabetes, you need to make lifestyle changes. If you have these health problems, it's likely because over many years you ate poorly, chose the wrong foods, didn't engage in physical activity, and couldn't maintain a healthy weight. So everyone, all of these factors are directly related to the development of diabetes. So if poor diet, sedentary lifestyle, and obesity caused your diabetes, do you agree that you need to take control of precisely those things? That's right. And these teas alone won't get you out of a sedentary lifestyle or help you achieve a healthy weight. They won't make you choose the right foods. They simply won't. But if you want to treat diabetes the right way, you need to make these lifestyle changes. So, look, if you don't know what to do, if you want to improve your diabetes control without medications, medical tests, or doctors, I recommend that you read my book, The Longevity Code, with 100 Habits to Live Past 100 Years. In this book, I'll provide you with a step-by-step guide, a complete manual on how to control diabetes, blood pressure, cholesterol, anxiety, insomnia, alcoholism, smoking, all this naturally, and yet again, you won't need doctors, medicine, or tests. I'll teach you the entire step-by-step process, and if you put it into practice, your health will improve, and you can reduce the dose of antihypertensives, anti-diabetic drugs, and statin for cholesterol. So if you like it, if it makes sense to you, I recommend that you click now on the first link in the description or the pinned link in the comments and purchase for only $29.90 your longevity code in digital format, which is currently the only version available. Dr. João, I spent $29.90. I didn't like the book. It didn't work for me. I threw my money away. No, you didn't throw your money away because you have an unconditional satisfaction guarantee. In other words, if you read the book and didn't like it or didn't feel that it was useful for you, no problem. I'll refund your money, okay? So there's no risk. You can purchase the book without any worries, and if you don't like it, you'll get your money back, all right? I'm offering this guarantee because I know the book is good. I'm confident that you'll like it, put the advice into practice, and that your life will improve after following the guidelines contained within it, okay? So click on the first link in the description below or on the pinned link in the comments and get your copy of The Longevity.